All right, we're going to go ahead and launch our session. I'm going to join all of us today. We are going to talk to everybody about how Department of Rehab and mental health departments throughout the state of California collaborate together around IPS programs. Just as a point of reference, there are 24 states in the country that have statewide individual placement and support programs. All of those programs have the DVR, Department of Vocational Rehab, as a partner with mental health in order for those states to be able to integrate IPS throughout the state. The state of California is a little bit more complicated, as we all know. Technically speaking, for the individual placement support learning community, which is made up of 24 states and 7 countries, would include California as a state as a part of that learning community if we had, a state and a state seat for both Department of Rehab, mental health, where we could also produce data and outcomes for the state of California. But as we know, that's complicated. And so that's why Alameda County has been very fortunate back in 2012 to be invited into that learning community, which gives us access to current research and data and training and resources for employment specialists, Department of Rehab counselors, case managers, you name it. So I am thrilled to have our panel today. I will let each person go ahead and introduce yourselves now. Della, we'll start with you.
Okay, good afternoon. Can you hear me? Okay.
Perfect.
Hi, good afternoon, everyone. A pleasure to be here. I'm Della Randolph, and I am the Regional Director for the Greater East Bay District.
Sean?
Hi, everyone. Happy to be here. My name is Sean Laurent, and I am the District Administrator for the Greater East Bay District. Welcome.
And Ms. Mahogany.
Thank you, Theresa. My name is Mahogany Harris, and I am a Senior Vocational Rehabilitation Counselor with the San Diego District.
Fantastic. So I love the fact that we've got the North and the South covered here, right? I think that just for the point of clarity, I think it would be important for Della, if you could share your perspective and philosophy of the work DR does with the population served. I want to make sure that everyone that's joining this session today really understands what the role of the State Department of Rehabilitation is.
Okay, thank you, Theresa, and thank you for this opportunity to share. Always happy to share about the Department of Rehabilitation. Almost 3 decades later, truly believe in the work that we do here. Don't know why I'm nervous, but I'm gonna give this my best try here.
You got this, Della. You got this. Don't you worry.
Our vision and our mission has always been and continues to be and will always be to serve Californians with disabilities so that they can have the same opportunities for employment, independence, and equality. That's the mission, that's the overarching goal, and that's our vision. From a standpoint of, my career path with the Department of Rehabilitation, and for the nearly maybe a little over 5 decades that we've been in the business of providing service for folks with disabilities, we're a state agency. For everybody in the audience, need I say more? State agencies don't always move with the rapid pace that we would like because there are a lot of layers and things that need to be taken care of before we can get to the business at hand, the business that we all are here about, and that's serving individuals to give them the opportunity and the advantages that they need. So over the past 5 decades or so that our department has been doing this great work, we've realized that there were areas that we could improve upon. There were processes and areas of service delivery that we could morph into something that looked more like quick delivery, person-centered delivery, and doing things with the intent to meet the person where they are and to provide them with the services that they need in a more rapid fashion. So I'm really proud to say that over the years, we have worked on ways to do that. And what we found with working with individuals with all kinds of disabilities, but this conference focuses on individuals with mental health and other psychiatric kinds of barriers that they need support with. you reach a person where they are, you reach them in that moment, you provide them with a lifeline. That is the key. Customer service equals rapid engagement when you're working with people who have marginal incomes, who have marginal support systems, and who have a host of maybe emotional challenges that they're trying to navigate as they look for work. So in terms of the areas that we've really improved upon that has allowed us to be more customer focused, be more intentional about our service delivery models to consumers, participants, individuals who come to us for help. I'm really proud that the department has had such a positive impact in the area of expedited enrollment. We have really soared in that area. I think that it was something that we did occasionally, maybe 3 years ago, 10 years ago, but for the last maybe 3 to 5 years, we've been intentional with moving the needle toward getting people in the door with same-day service. We have a statistical rate of success of getting people served within 5 days. It's phenomenal. It's about 80%, I think, of our participants reach eligibility within 1 to 5 days. And then we have another area that we're looking at that we're really wanting to improve upon, and that's same day service. And we have actually done a lot better in that area. We have a large percentage of our individuals that come to us same day, and we're able to get them in the plan and get them going. So with regards to my passion, my perspective, and this conference and how we can continue to work together and focus on rapid engagement, which is the embodiment of the IPS model, meeting the consumer where they are, breaking down all those silos and barriers of the bureaucratic piece to help serve the individuals with intentional person-centeredness. So that's my philosophy and perspective on the Department of Rehabilitation.
Well, and that expedited enrollment, I think it's important to underscore that, I've been in this field for 30 years and don't tell anybody, it was 3 months, right? Wasn't it like 90 days that when you had a referral to the State Department of Rehab, it took 90 days to determine eligibility, that was the norm?
There was a 60-day eligibility and a 90-day plan. And, those were all written words that we maybe felt like we needed to live by, because we're a state and federal entity. And maybe that's what we felt we needed to live by for some periods of time, but not anymore. We're meeting people where they are. So I appreciate you highlighting that memory, Theresa. Yes, 30 years ago, that's where we were. Today, not so much.
Right. And you guys do all of your stuff online now too. Authorizations, billing, everything is through email or online, which is you guys blew my socks off when you made that announcement. I was really impressed.
Yeah, absolutely. It's exciting to have our consumers have the same opportunity that anyone has to put in a debit card someplace, get the services that they need without standing out and being different in terms of how they purchase and with the rapid expedited manner. So yes, we're super excited about that too. Our socks are blown off as well, Theresa.
I want to remember also, and then we'll move on to the next question, that I had a DR supervisor tell me many years ago that probably 70% of Department of Rehab clients have a mental health condition. What would you guys say? Is that accurate or?
I would say yes, and here's why, and Sean and Mahogany, please chime in. I would say the reason I say why, because sometimes in my experience as a counselor, they presented with something totally different, came in with some other kinds of issues, unemployment, and some challenges with filling out forms because of a learning issue. And you dig deeper, and there's a lot more to that first presentation. So yeah, so there were a lot of undisclosed, maybe the reason I came here is to get help with getting a job because I can't read to fill out these forms. So yeah, right. I think 70% is probably an accurate number.
Yeah, I would agree, taking into account dual diagnosis, and then the presenting disability, as Della said, if they come in with a physical disability, that's the first thing that we kind of think about is what we can see, but there are often other underlying disabilities that are not necessarily disclosed at the time of application.
And also, if I may chime in, we saying 70%, but let's not forget about COVID. COVID
Mhm.
caused a lot of mental health disabilities around individuals with mental health disabilities. May have given them depression, may have stirred up some disabilities that they didn't have before. So I want to say 70%, but because of COVID, I want to say it's a little bit more. We have more homeless population, and I want to say there's a high number of homeless individuals. And I say probably 90% of those individuals that are homeless at least has an Axis 1 diagnosis of a mental disability. So I want to say because of COVID, I think the numbers may be a little bit higher just because of those things that has happened in the world.
Yeah, that makes sense. Yeah. So, I mean, that makes Department of Rehab even a better partner, and that the work that you do on a day-to-day basis, that you are working with our peeps, you're working with our clients every day, and it only makes sense to have a strong partnership. And on that, Sean, what do you think? What is the role DOR plays with mental health clients who are seeking employment? How does the department provide services with this population?
So what we do, we treat them as any other participant, but we try to give them the focus. Well, I'm gonna talk about the piece of someone coming through the door, or the piece of us having the collaboration we have with Alameda County Behavioral Health. And so if someone with a mental health disability came through the door, we would provide them services as if we would do assessment if needed. We would get them in plan, make them eligible, and we'll look at what their vocational goal is based on their barriers. I remember at one point when I was a counselor, I had a mental health caseload, and I would meet with we call them participants. I would meet with them and ask them, let's talk about what you like to do. Not only talk about what you see yourself doing, what you enjoy, what you like to do, but let's talk about what you think you can do based around your barriers and your disability. And so we look at that and try to keep them engaged and try to build we call them individual plan for employment based on their interests, based on their disability, based on their barriers. So when they are in plan and they do find that work or that employment that they enjoy doing, they're going to stay on it. They're going to enjoy it. They're going to be there. On the other side of that, and I know we're going to talk more about it, with the ISP model with Alameda County Behavioral Health, what we do is we work closely with Alameda County Behavioral Health. You heard Della talk about rapid engagement. When I say rapid engagement, I'm not going to use rapid engagement. I'm going to use the word fast engagement, because what we try to do is we collaborate with Alameda County Behavioral Health, and we really work with getting the individual into plan as soon as possible. Like to keep that consumer engaged, because statistics shows that you have a mental health person, if you don't get them engaged rapidly, fast, then you're going to lose them. I know there's oftentimes disability may play a part in how they move, how they function. But let's say you get someone that may have depression or may have schizophrenia, and you get them on a job, that depression may go away. You may see a different side of them that you've never seen before. Schizophrenic person sitting at home, they may hear voices most of the day. But then when you put them on a job and you get them there and you get them involved, those voices may limit. They may be able to function on a job. And it's amazing to see how when you work with an individual rapidly and get them going with the supports, and I want to throw that in, with the supports with Alameda County Behavioral Health, we work together as a team. We collaborate. We make sure that we staff and get the consumer going so we can keep them rapidly engaged and talk about things that may come up that we may be able to give them that whole support wraparound service system.
So, I think it's important to say that, we're kind of getting into some of the challenges, for example, that we've experienced in partnerships over the years. And Mahogany, you might reflect things that have happened in the southern part of the state as well. Sean, you know, is a really good partner, has been a really great partner for Alameda County because, you know, there was a time a few years ago that we had well over 100 referrals to the state over the course of 2 years and had maybe 10 clients opened. Um, you know, and then Sean came into the picture and we rolled up our sleeves and started to develop a relationship and to try to figure out how we can really get these clients working. That, you know, we understood the partnership need for the state DR with mental health and in IPS and also just the need for the client, right? Because there's
Mhm.
resources that the state can offer that mental health doesn't have the resources or money funds for. And so today I think we have like 40, you know, we had 40 referrals and 40 cases that are open, okay, which is a dramatic turnaround from where it was a couple of years ago. And we have a different level of collaboration, right? We, you know, we meet and have an ongoing relationship with the Department of Rehab staff, the DR counselors who are working with our joint clients, collaborate with the mental health employment services team on a regular basis. You know, we exchange documents, conversations, strategy sessions, you know, to be able to make sure that we're supporting the client in their employment and educational objective. You know, I want to make sure that we also note that a lot of clients will be referred to the State Department of Rehab for school, right? You know, and that is also a part of IPS, actually. You know, supported education, you know, is something that our unit also utilizes and is another service that we provide. And you know, and we also try to help and advocate with our DR partners to access resources for those who are going to school as well. Mahogany, you could probably reflect some challenges and some efforts in San Diego, I imagine, right? That have that you've experienced.
Definitely speaking on what Sean talked about, you know, when we talk about the impact of COVID and how it impacted so many of our, you know, consumers, potential applicants, participants. And what I've seen personally with our mental health population is that homelessness is huge, and it has impacted, you know, everyone. Those who weren't homeless before have now become homeless because of lack of a job and things like that. You know, but I really love that our cooperative contract that we have with mental health systems, which is a partner of the San Diego Behavioral Health, has really been significant in, you know, helping us to bridge that gap in homelessness and helping our mental health population gain independence. You know, the contracts, the referrals come to me directly. It's a really streamlined and quick process for them to get in the door. You know, I get the application via email from mental health systems. I get them, you know, scheduled for intake. We do the intake, they get expedited enrollment. Every single one of the applicants that come from our mental health services contract, they get expedited enrollment, all of them, expedited eligibility, I'm sorry. And then, you know, if they already know what they want to do, and like Sean said, if we go over what their interests are and hobbies and things like that, that helps me to develop the IPE and we can get that done right away. In cases that, you know, it's not, then we do work with our contracted partner to create a career profile that, you know, helps kind of eliminate the challenge that the potential participant may have in deciding what they want to do. And they go through a battery of testing, which is usually done within a 40-hour window. And then after that, they send the career profile to me, and then the plan is developed. So it's all done well over that normal, you know, 90-day window that we talked about once upon a time. You know, but again, I think the biggest challenge that, you know, and I know our office has talked about it, is the homelessness in the San Diego area. We have a huge population of, you know, military. A lot of our military veterans experience mental health because of PTSD and, you know, whatever the co-occurring disabilities may be. So that's one that I think if we would to maybe work more with the Veterans Affairs, as well as a lot of our homeless organizations in the area, might eliminate that challenge of helping, you know, our consumers get employed and maintain their housing, which is huge if anybody wants to have a job. I mean, you need to have somewhere to lay your head every night and be ready and prepared to go to work. So I think that that's a big challenge that we're dealing with down here.
And if I may just chime in, for those that don't have ISP program or looking toward the future of an ISP program collaboration with mental health, some of the challenges are you on the DR side and what agency you're working with, you want to have a staff that is somewhat knowledge of an individual with mental health disabilities. That person having that knowledge and then buying into, and I don't want to use the word buy into, but them having that knowledge and knowing and understanding that if you have someone with a mental health disability, that if you don't prolong them going through all these processes, all these assessments, if you take that individual, get them into a plan, get them out in the community looking for work or whatever the individual plan, if a customer goal may be, that individual that's working with them needs to understand that they need to rapidly engage that individual so they can be successful. There may be bumps and bruises along the way, but what happens is, and what's good about the program and the collaboration with Alameda County Health is, we are able to call each other, email, phone, drop in before COVID, and we staff what is going on. How can we fix this? What can we do? Communication is the key. Communication and really following up and providing wraparound services for that individual. I'm gonna give you an example. Let's say you have someone that wants to be a truck driver. They diagnosed with mental health disability, schizophrenia. The doctor has prescribed them medications for at nighttime. This individual wants to drive trucks, but most of his driving will be at night. We all come together. We may bring the psychiatrists in, we bring the VSs in, Department of Rehab. We come together and we talk about this individual's interest and how can we amend or adjust things so they can participate in the vocational goal that they want to do. And so that's what makes it so important to have that collaboration and that communications.
Right. So what I hear is that that by coming together as a team, that you're addressing the barriers one by one and strategizing to see how you can remove those barriers, which
Yes.
then allows that person to get closer to that training and to working in their preferred profession.
Yeah.
So I have to ask though, with the mental health population, they can be a little inconsistent at times. What is your take on a client who doesn't show up for appointments right away, or doesn't call back, or doesn't get those documents back?
But what's good about it, if I may chime in, I'm sorry, Theresa, because I'm excited about this. Mental health is my thing, Della, I tell you. What's excited about it is if the participant is not participating, that counselor calls that VS, calls that vocational specialist with mental health and say, hey, I haven't been able to get a hold of this participant. Or hey, as far as documentation, all that's done when they're referred. All the Department of Rehab does, and I thank you for this, Theresa, but all they do is give you the paperwork that counselor inputs them in the system, and that's it. If we need anything, like I said, there's an open door. We call, email, Zoom, whatever it is, stop by. Those forms are there. We both collaborate together. I often say Alameda County Behavioral Health and Department of Rehab, but I look at it as us as one because we're both doing the same thing. We're working together to serve this individual to get them served. So we work a lot together. There's things that Alameda County Behavioral Health may get that we can't get. And so if we can't, we reach out to them and get them to support us and getting this person re-engaged or engaged. So those are the pros of having this kind of collaboration. So.
Yeah,
I
and
wanted to add
oh,
to,
go ahead, Della.
I'm
I'm
sorry,
sorry.
I've not been a direct service provider or counselor for a long time, but this brings me back to what was important for me to always do, not make the individual feel like a failure because they couldn't do it this time. To always leave that door wide open for next time. You know, we talk about what may have gotten in the way, the barrier that may have, you know, not allowed them to keep the appointment. But I think it's important to have them leave with the feeling that, phew, they're not disappointed in me. They're not going to just close the door, and not be so quick for us to kind of close them out and close the case, but to look at some intervals of things to do and to let them know that I'll be here when you're ready. Just call me. We'll figure this out. So I think that's important. Everybody wants to feel like they're successful and not a failure because something happened in life that did not allow them to move forward as rapidly as they would have liked to. So I think that's an important piece.
Yeah.
Mahogany, you had something to add.
I did. I definitely agree with what Della was saying. You know, we want to encourage our, you know, consumers to want to stay in this, you know, fight for independence and success. You know, and the other part that Sean was saying about the collaboration and the open door policy. I mean, I have, you know, my employment specialist with mental health systems. If they say, I haven't talked to this person in a while, have you talked to him? And we're going back and forth on email and, you know, no worries. I talked to him last week. He said he was going to do this, or, oh, well, he didn't reach out to me. Let me give him a call real quick. And it's, you know, it's a real partnership. It's not anytime there's anything going on, we communicate with the team so that everybody knows what's going on with this one person. The other part is we have, you know, we have quarterly meetings with the unit. We also have monthly meetings, myself with the management over at Mental Health Systems, along with the administration. And we discuss, you know, my particular caseload from Mental Health Systems. And each counselor with DOR in our district meets with their mental health person, you know, on a monthly basis so that we can update. What have you heard about this person? Or is there any information that, you know, you don't have? Because we need to make sure that every part of the team knows what's going on so that we can continue to support and make sure that this consumer is successful in the end. And if they're not, then we're on the same side of, you know, maybe it's not that person's time right now.
Yeah, that's true.
Well, you know, I wanted to, you know, put out there too that Mahogany is talking in reference to a mental health co-op in San Diego, and I'll need one of you to explain to everybody what that means. Whereas Alameda County, we do a fee-for-service arrangement, which is also different. Okay, so maybe you guys are the pros. You could, you know, explain what the distinctions are of those two things.
Well,
Go ahead,
go ahead.
Della.
Well,
I was just going to say I'm not really familiar with fee for service. So,
okay.
Well, the co-op is a collaboration with a behavioral health system in DOR where there's a contract. There's a contract involved. Usually they're 3 years at length and they cover a wide scope of services that you all are all familiar with the provision of them, but it just gives some specifics around how it's going to be done. There's money exchange from the county side of things and money exchange from the DOR side of things. And together, this 1 to 3 year contract usually is made with a number of participants that will be enrolled in the program, number of participants that will go into plan development, and a number of participants that will be successful closures. And that carries with it everything that we're talking about here, but not the same fidelity model and intentional process that the IPS model carries, but it is a collaborative effort. I was going to say too that, you know, and this opportunity to do different and do better and do more, this is what DOR is all about. So when I'm looking at statewide, and that's our northern and southern and central parts of California, I believe we have about 19 mental health cooperatives and another maybe 25, 26 case services type contracts. And so I'm looking at 45, 46 collaborative efforts to do the same thing, wrap around and support our individuals who have psychiatric disabilities, who have a desire and an interest and an intent to go to work and live independently and have that equitable landscape life that we all want. So those are 45 or 46 different collaboratives going on to serve the same purpose, and that's to meet the needs of consumers with psychiatric issues, put them in the workforce. So I hope that gave some perspective on what collaboratives and co-ops we have within the state.
Yeah, that's very helpful. So for fee for service, can you explain the distinction with that? Or I guess I can, because we
Yeah,
do it. I just, as a fee for service provider, we had an application that we needed to complete with the State Department of Rehab to be a fee for service provider. It's an agreement, not a contract. And so the Department of Rehab agrees to pay us per an authorized service. So we are authorized, or we can be authorized to provide intake, employment preparation, employment services, and retention services. And also we're authorized for job coaching. The difference between a contract and a fee for service is that a fee for service, we send a request. We have a client who is referred to us, who then is one way or the other. Either the client is referred from the state, or we're referring to the state. It's usually mental health referring to the state because we have the clients. And the Department of Rehab opens that individual. The DR counselor then provides an authorization for services that has the specific dollar amount per service. Okay, so the state pays, I think, a specific line amount of money for each service that is authorized. Once those services are provided, then we send documentation in, and we get paid, per the service. Versus a contract is a contractual dollar amount. And so you have, when we used to have a contract many years ago, we would bill to the contracted amount using specific codes to draw the money down, and make distinctions between this is a DR service versus a mental health service, so that if we ever had a review or an audit from the state or from mental health, we could say, well, these are employment services, Medi-Cal, and see, we didn't bill Medi-Cal. This is the DOR code, versus DR. See, these are we did job development and we prepared resumes here, or whatever it happened to be. We were doing marketing without the client, and so there's no Medi-Cal crossover. So the lines are clear.
Theresa, if I may point out something as well, you all heard Della explain the cooperative contracts. Contracts have measurables. When we utilize the ISP and Mental Accountability Health, there are no measures. We use them more paying for services. So just wanted to point that out to everyone.
Okay. So let's see here. So what are the employment outcomes for your, various services? I can say, in representing Alameda County, that that we have about a 47% job placement rate, that 50% of the clients who are referred to us get a job in the first 90 days. And so with the expedited enrollment for our shared DR clients, this is fantastic, because it means that those clients are getting on with the state early enough to be able to access transportation resources, resources for interview clothing or special shoes, consultation with the DR counselor as needed around other training, and other types of services that would be useful for going to work. Mahogany, you could probably reflect even more.
Yeah, we have, I think that there's so many, the needs are so great, as first of all, with our consumers. But in our quarterly meetings, that's when we kind of go over, all of the outcomes we have. For me personally, I would say I have at least a 65 to 70%, employment rate with my consumers. Now, I don't have the largest caseload of the mental health services, But, because of the expedited eligibility and us being able to move so quickly, like Sean was saying, to move fast and to use rapid wraparound services, we're able to get them employed more times than not. In cases where they're not able to be employed, it's just because they have so many barriers that need to be addressed before we can, move forward with employment. But in most cases, I think I would agree that, we're able to get them employed and we have successful closures.
Working.
Yes, working is
Yeah.
the key.
Sean, you have something to offer.
Yeah, and I know on the Oakland side, we came on board and we reamped things and processes to work for both of us. And I know the caseload is around 40 to 50. And I haven't done the statistics, but just by me, when I was at the time overseeing the staff that managed that caseload, out of that 40 or 50, I want to say at least 25 to 30 of those individuals are employed and working and still working. And so the success rate is pretty much high based on the number of consumers that we're serving in that area.
Well, and I think it would be good actually to have this conversation that one of the things that we've noticed in working this model IPS is that sometimes the client will come to us and they've never had a job before, right? And they're 30, 40, 50 years old. We have, 10% of our clients are over 60 also. And so that first job, we have an authorization for services for that to do the job development. Client gets that job and they lose it within a month. Okay. It used to be that when that happened, it was a done deal. The client was going to go on the bottom of the list because they weren't ready, right? Now with IPS, what we tell people is that, clients are just getting warmed up, that they know how to get up, get dressed, go to interviews, and they got their first job. And after a month, they realized it wasn't a good fit. And so they quit or they're terminated or whatever the case may be. We keep them on the top of the list and we just keep going. And
Re-engage.
so and our DR partners have jumped in with us, okay, because we had an agreement that I think we created locally, and Sean, you can help me remember this, is that because it's been a while now, that if a client did lose their job in the first month, that we could reinitiate that authorization for employment services.
Yes.
Sean, you want to speak more to that?
Yeah. So let's say this person loses a job or finds out they don't want the job that they have. And if it's within their vocational goal plan, IPE, if it's in the individual plan for employment, if it's the same vocational goal, we just re-engage, reauthorize, continue services for them. If they come back and say, Sean, or Theresa, I don't want to work in customer service no more. I want to be an office tech. We amend that plan and we continue services, re-engage, reauthorize, and continues that support. So it oftentimes it does not have a gap in between because of the communication and collaboration. Because of those two things, we are able to really get the participant, keep them there, keep them engaged, and then as staff-wise, Department of Rehab and Alameda County Behavioral Health, we meet with that individual to look at, do they want to keep the same goal, vocational goal, or do they want to change it? So the service is a nonstop service if that type of situation happens. So continuously services.
Mahogany, you experience the same in San Diego?
Absolutely. Absolutely. I mean, you got to remember that we're working with a person with disabilities.
Yeah.
And even myself, who doesn't have a diagnosed disability, I changed my mind. And they may change their mind. Maybe they thought it was going to be something and they get into the job and it's not what they thought.
Yeah.
I do tell my consumers that don't just quit the job, just, because we have that too, to where they just go there on Thursday and I don't like this job anymore, I quit today. No, let's talk it through. Let's figure out how we can maybe make accommodations on this job so that it is it fits better for you. And if it's just, ultimately not the job that they want, that's okay too.
Mhm.
You separate from the job professionally.
Mhm.
We explain that to them and so do our mental health services partners. So we, teach them that, how to leave a job professionally so that when you move on into the next job, you know how to conduct yourself appropriately. In addition to that, if, like Sean said, if the plan changes and we want to do a totally different vocational goal, then we just do a new plan. Let's explore, let's talk it through, let's figure out what needs to happen. We get on board and in communication and collaboration with our mental health services partners so that everybody on the team is in agreement with this new goal and feels that it would best fit our consumer. So continue collaboration, continued communication. That's the bottom line.
Yeah, and one thing is they may quit their job. They may have needed some supports that we didn't know they needed. And so with the collaboration between the both of us, we find out what supports they're getting and what do they need, what other supports they may need to help them with the next job. Because as you know, you may not know that they may get on that job and not know what supports they need. So as they go through that job, and if they do get terminated or if they do leave, we may be able to meet with that person to be able to find out, hey, I need these other supports. And so we work together in finding those supports for them so they can be successful on the next job.
And to add to that really quick, that piece, not knowing what accommodations are available in a certain employer, if DOR and mental health systems are continuously referring people to these same employers and they're not able to provide the accommodations necessary, that's the conversation that we need to have with the employer so that moving forward, we can maintain these relationships because again, it's a collaborative effort to get our consumers employed and the employers are a part of that collaboration. So we want to make sure that moving forward, we have the things that our consumers need.
Yeah,
Absolutely.
I want to underscore that, Chris had run some numbers for us. It's been a while now, but one of the things that we determined is that, and this is really rehab data, you know what I mean? Because our clients would go to work, they might lose that first job. We get them another job, like within 30 days, that job lasts 6 months. Okay, maybe they quit that job. The next job lasts for 3 years. So what we notice, and it makes sense really, right? Because you are building vocational, a better understanding of your own vocational development. You are learning as a person with a disability that not all job fits the exact same way. And you're trying to find something that's in alignment with who you are as a person. And that's what helps that job to stick. Right. Della, I know you had a comment.
Well, yeah, I think I was just going to say something with regards to what Mahogany said about changing of the mind. Yes, you just change your mind sometimes. This growth and development, maybe just a maturation process needs to kick in and help a person to kind of know what they want to do for 20 years from now. But I think the openness that the Department of Rehabilitation has to keep allowing and keep encouraging, let's try this, has really been heightened with our 2014 WIOA serving youth, working with youth with mental health issues or learning issues, that it's an opportunity to introduce them to the world of work through work experiences. And I don't see this much differently as the 40-year-old who's never worked before. He or she may not be 15 or 16 just starting out in the work world, but they're starting out work for the first time. And so they need opportunities to have experiences in the workplace to kind of test it out, like we all have had. And so I think that's okay. And I think we need to punctuate that when we're meeting with them and they may not have met that success the first time, second or third time. But I like your growth chart from 1 month, 6 months, Theresa, to 3 years on the job. That's what we can, kind of look at in terms of progression with this population as well.
Great. Thank you. Nice discussion, everybody. I have another question here for you guys in that how can clients access services and how is technology and community resources currently utilized to help with access? I think Della, you had kind of referred to it earlier.
Yes, we have such just 22 ways that folks can access our services now. You know, we have a portal, an online portal that people can go on at 2 o'clock in the morning if they're having insomnia and they're thinking about their life and what they need to do. And they heard about this rehab program at a job fair or something 2 months ago, and they're going to go online and apply. I mean, they can apply for services online. They can walk into any of our DOR offices all over the state of California, go to a window and say, I want to apply for services. They can mail in a letter and say, I want to apply for services. And our director, Joe Xavier, will say, if they write it on a napkin, we're going to accept that. I guess the part that has shifted so much is that we want to meet individuals where they are when they show interest. We want to not get hung up on the type of form it is, the type of piece of paper that it is. We want to get started with the process. So I think our online approach has been so wonderful for individuals who, you know, may not be ready when they hear about us, but then they have our website address and they can go online and go into that portal. And we are efficient in managing that portal and getting those statewide requests. If they're in Mahogany's area, zip code wise, they go directly to areas in her catchment areas and our areas, Central Valley, all over California. So it's just wonderful. I'm really excited about that. We don't have to wait and snail mail the packet or snail mail something, you know, 80 miles. We can just do a lot electronically. So I'm juiced about that.
And just to add on to Della, we do have, I think it's Twitter. We do have those platforms to where they can get information off of Twitter, Instagram. I'm old school, so I don't know them all. Instagram, Twitter, and a lot of the platforms. So, and Facebook. So we reaching out to the youth with those kinds of platforms because we know they love those kind of platforms or social media platforms, they call them. We are reaching individuals that way as well. So they can utilize any social media platform, Facebook, Twitter, Instagram, to get information from us and how to contact us.
Awesome.
And just in addition to that, all of our community partners, when you go on to regional centers, all of their websites have a link to get to our website as well. So we're here.
Yep.
There's
Well,
no excuse.
Yeah, it really sounds like DR is really starting to modernize very rapidly. I mean, really, it was only, what, 5 years ago, we could have had a very different conversation. So it's kind of miraculous. You guys, really, I mean, it's amazing. And so to kind of tie up our discussion a little bit, I wanted to just sort of provide a word about co-op programs that are interested in using individual placement and support. You know, IPS is really around embracing a philosophy, as well as being willing to roll up your sleeves and having, as Shauna said, collaboration with your local mental health partners. So there's really, you know, 3 legs to the stool here, right? There's the local county mental health, there's the local Department of Rehabilitation, and then there's whoever the vocational services providers are. Now, in some counties, it's 3 legs. In our county, it's unique because we actually have a vocational services unit in mental health. Okay, but that makes us a unicorn. I think that most you know, like, you know, Mahogany's referencing, you know, the co-op in San Diego where they have a vocational services organization that is providing the direct service of employment, you know, with their collaboration with the state. And then that means that community-based organization is also then probably contracted with the local mental health county, right?
Yes.
Right. So, and so that makes it, you know, that's probably how it mostly is. So what's good about those co-ops is that they already have the ingredients, right? You have employment, you have Department of Rehab, and you have mental health, and mental health is the referral source. So it really just takes that everybody, the key partners, sit at the table and go through the principles of individual placement and support and understand what everybody's role is in that process. Also incorporating fidelity reviews, you know, to check and see how closely you are providing services to the fidelity standards. The bottom line is that the closer to the standards you are providing the services, the higher your job placement outcomes. So it's pretty straightforward. So I just wanted to put that out there that I think there's a lot of support at the state from the state DOR. You heard it from Joe Xavier this morning. You hear it from Della today and Sean, to embrace IPS as a way to be efficient in helping people with mental health issues get jobs. But I want to say to you, as a person with a rehab degree, in addition to a clinical license, that this model works with a lot of different disability groups. Dr. Bond referred to it this morning. Whether it's individuals who are homeless, people with traumatic brain injury, people who have been opiate users, transitional age youth, developmentally disabled, et cetera. CalWorks. In fact, this afternoon, our very next session, you'll be able to hear how individual placement and support is being utilized with some amazing specialty populations. So this afternoon, we'll be focusing on CalWorks, homeless, and also the transitional age youth programs and services. So if you want it, just raise your hand, okay? Just say, we're down, okay? We're gonna make this happen. It takes somebody to be a champion. You have to pull your champions together so that everybody's on the same page. And then once you get things nailed down, everybody gets to reap the benefit of that. So it looks like we have a couple of questions here for the panel. Let's see here. So one question is, to what extent does DOR go to in helping participants and customers? What type of service supports do you provide? Example, work clothing, boots, or what don't you provide? So who would like to answer that?
I can answer that. For me, the things that I tell people when they say, well, what services do we do? We don't do housing and we don't do food. Outside of that, yes, we provide clothing if you need work boots. For the most part, if it's related to your employment goal and it's something that you need for your employment goal, like I said, with the exception of, groceries and your rent, there's a lot of ways that we can get creative and get those things available for you. The clothing, we order interview and work clothing all the time. If you're going to school and you need textbooks, if you need professional licensing for your job that you want to do, we can pay that too. It could be anything, printer paper. I mean, the list goes on. And a lot of times when people ask me that, I'm like, look, tell me what you need and I can tell you if we can get it. Because the list is extensive. And then there's special circumstances. If you need new glasses, I mean, those are things that we can do on our end to help support their success and employment. So it's kind of a long list to just say what things do we provide. There's all kinds of things that we can provide.
Yeah, and if I may just chime in. Go ahead, Della. You go ahead.
Well, I just wanted to say it's so individualized, for that person who posed that question. Mahogany did a great job of listing out some of the services I'm sure that she has provided, but it's so individualized. There's always a unique 204. That's one of our documents to help us to pay a vendor. There's a unique vendor in our system right now. I'm sure we need it for one person because that one person needed that one thing we had never bought before, but we were able to get it because we found a vendor, we got it. So I'd like to say it this way. We don't want to put the services in a box. You just want to have a conversation with that counselor and talk about what that need is, and let's look at how we can get to yes, because the whole goal is to help that person connect with those services they're going to need to get to work and maintain their jobs. And we do have some creative counselors in our employ. I will say that some hardworking researchers, and Mahogany can attest to that, that will find someone who makes this device or makes this thing that we can only find here, and we can make that happen. So just remember this keyword for the person in the audience who asked that question. It's an individualized journey. And so services sometimes are very unique to a specific person's need and request.
Yeah.
So Mahogany, we have another question for you about the assessments that you mentioned that are done in a 40-hour time frame. The question was, who is doing those? Is that the IPS staff or the State Department of Rehab? And are you referring clients to IPS staff prior to plans being written for assessments? And also, which assessments are you using? So we can break that down as we need to.
Okay, so the person or the mental health systems co-op is who conducts the assessments. And what they do is a career profile, and they go through, you know, different exploration of careers, hobbies, interests, and things like that. And they do it over a 40-hour span. So it's like done within a week. That's how they frame it. And so they go through all of these different meetings and discussions with our consumer. It is done after, so they come to us, we get the referral, I do the intake. After intake, they are made eligible, and then I immediately send over an authorizing case note for them to get vocational assessment. And then what happens is that's when mental health system goes to work to help develop the career path for that consumer. After that's completed, they forward it to me, and then I create the IPE based on the information that they collected with the consumer.
Okay, and they asked which assessments are you using? So, yeah.
I don't know what assessments they're using because we don't do it. They do.
Right. Okay. Yeah, I was going to say too, as a point of reference, like for our Alameda County program, we have mental health assessments that are given to us from the mental health providers who are referring the client to our unit. Okay, so mental health providers, the clinicians, the psychiatrists, you know, are referring a client with a simple referral form to vocational services. You know, we access that assessment, that clinical assessment that they have written, and that becomes a part of our chart as well. And then when we refer a client to the State Department of Rehab, we use what documentation we have on hand, whether it's plans or assessments, you know, the career profile that is written by the employment specialist. We also have a psychosocial rehab, you know, assessment that's done by our in-house rehab counselors. And all of that is sent to the DOR counselor to help open the file with the state side. So, you know, there's definitely different types of assessments. I think that word is different in mental health than it is in rehab. So we
Yeah.
have to be careful how
Yeah.
we use it.
Yes,
Um,
Theresa. If
go
I may,
ahead.
because in the rehab side, we usually do a lot of interest inventory tests to find out what their vocational interests or strengths are. And we kind of, I'm not gonna say we stirred away from assessments, but now the Department of Rehab have work experiences. And we did student work experiences. Now we have adult work experiences. So we can, instead of doing an assessment, keep in mind, we work with mental health individuals and we want to keep them engaged. So what the department has created is work experiences. So that person can do a work experience and they can get assessed while they're doing that work experience to see what their vocational needs are or interests are. So I just wanted to point that out.
Great, thank you. One other question, I think we still have a couple minutes here for a question. Does each DR site have a transitional age youth specialist or a student support DOR specialist?
Well, in theory, and it's a really great question, in theory, we're all supposed to have a student services point of contact. We're supposed to have a team that is specifically, not solo, but specifically versed in student services and engaged with the high schools, the mental health system that serve youth, the foster care systems that serve youth. So yes, in theory, we do have points of contact within each Department of Rehabilitation region that services individuals that are in youth populations. So I hope that answers the question.
Okay, awesome, thank you. Okay, so we have about 5 more minutes and then we're going to take a break. So would any of my distinguished panelists like to say any final words about the state and IPS?
I guess, no, you want to go? Or I can go. Well, I just want to leave you all with is that this collaboration has been going real well. You may have some bumps and bruises along the way, but the key to it is collaboration and communication. As long as you start off with those two things, and it has to be strong, and everybody have to be on board. And if you can start off with those communications and collaboration, and I'm gonna throw in everybody having the same mission of serving that individual. And since we're talking about mental health, I'm serving that individual with mental health disabilities. If everybody is on the same missions, meaning same page, and serving that individual, that it will run smooth, even though you may have bumps and bruises, because you're gonna go through processes. Our Department of Rehab processes may not work as fast as your process, the other agency processes. So you come together and collaborate how y'all can make the process smoother for you, the agency you working with, and the consumer. So I want to leave you all with is collaboration, strong communication, and there's going to be bumps and bruises along the way. But as long as you have those, you're very successful.
Well,
Della, did you want to add?
Yes, I think the model, it's an inherent impassioned need and desire for us to do the right things and serve our consumers with integrity and intent. So I think I would leave everyone with the pieces that we need to pull together and put together to serve consumers in the most efficient way and the most intentional way for their success. That's what I'm all about. I want to be the pioneer. I want to be the forerunner or the continued person who continues to carry that philosophy and leave that when I am maybe no longer the person sitting in the seat. I want to leave that as part of the legacy. Service and service well.
Thank you. Mahogany.
Well, I agree with Sean and Della, but one thing I think that for me, and this is in my everyday life, work life, outside of work life, is we have to be creative. We have to be creative in creating opportunities, in how we may have to work with each consumer, because everything is so individualized.
Yes.
One thing is not going to work for consumer A that works for consumer B. So we have to be creative and be flexible in our approach with all of our consumers.
Oh, I love that. You know, I think because, you know, again, it kind of goes back to what I was saying earlier, that what I like about this model is that it treats our clients as we want to be treated. And I don't know about you, but I don't want anybody to treat me like a cookie cutter, you know, that I'm the same as every single client that you have worked with today. And I'm going to just do the rubber stamp approach that, you know, we are all individuals and we have strengths and weaknesses we bring to the table. So how can we, you know, take those strengths and weaknesses and use our skills to be able to channel them towards a person's goal to work, right? And reduce those barriers along the way. All right, well, thank you guys. That was awesome. You're all dynamite, top on my list.